Okay, thanks to DRNI for the opportunity to present today as part of the webinar series. I'm delighted to be here to talk about transfer and exchange of research knowledge, and I'm particularly always happy to talk about EMTReK, which is a project I worked on with my dear colleague, Professor George Kernahan at the University of Ulster, funded by the All Ireland Institute of Hospice and Palliative Care. EMTReK is our evidence-based model for the transfer and exchange of research knowledge. And over the next half hour or so, I will tell you a little bit about the context for that work that we did, introduce you to the model itself, and tell you a little bit about how you might use some of the components of the model, some of the messages and key lessons from that work to think in a very broad and effective way about your own research dissemination and communication. So I suppose the first thing to highlight is that the whole issue of knowledge transfer and exchange sits within a much wider context, which brings together a number of different principles, practices, and areas of research. And I suppose with my background in palliative care and intellectual disability and your own interest in dementia, we are working in the sort of very broad area of applied or health services research. This idea where the research is being done to really tackle existing problems, questions and queries within practice and applied settings. So the focus is on how we can conduct the research to the highest standard and then apply it into those locations and into those settings to inform practice and policy and change where relevant. And I think this movement or the increase in this type of research is very much connected to the discipline of implementation science, which some of you, if not many of you, will be familiar with, which as a discipline or as an area focuses on how do we ensure that the lessons from rigorous research from across multiple disciplines are implemented or positioned and support the implementation of new knowledge, of new interventions, new practices. Related to that, within organizational settings, the commitment to quality improvement and the processes of quality review and quality development would very much be influenced by some of these ideas and principles, particularly the role of research and not just sort of academic research, but also local research in the quality improvement process. And then in an area like dementia and related areas, the idea of translational science or translational research is very relevant. The idea of, we talk about bench to bedside, making sure that the research, even the most basic research, where there's implications or applications in practice, can be translated. And it's within this context that I position knowledge transfer and exchange, also called knowledge translation or knowledge mobilization, or simply dissemination and communication, as a practice that's central to some of these areas. To make sure that your research can inform practice, or any research can inform practice, there has to be a process of transfer, communication, translation in that. The last area or last part of the context I'd stress is public and patient involvement, and it's been fantastic in recent years to see the increased commitment and involvement in meaningful public and patient collaboration around developing and implementing research. And this is very directly connected to knowledge transfer, because one of the ways that you can best disseminate to target audiences is to work with representatives of those audiences to make sure that your messages and your messaging are appropriate. So this for me is the context in which we've been working on the topic of knowledge transfer and exchange. And from a practical point of view, I feel it's always useful to present a definition, because there is so much terminology in this area. And when George and I started this project, we identified knowledge transfer and exchange as our preferred term, and this definition as capturing our understanding of this concept. So it is the idea that it's an interactive exchange between users and producers of research. So the researchers are the producers, but ultimately the managers, the service organizations, the practitioners, the patients and their families are the users of that information. And its purpose is to increase the likelihood that research will influence policy and practice decisions, but also recognizing that interactive element, that researchers are more likely to be asking and answering questions that are relevant to practice and policy, or influenced by what's relevant to practice and policy. So this is the sort of framework that we adopted. Now, it is important to say that there is a lot of literature out there that relates to elements of KTE. There's over 60 different models that we identified in the literature that in some way address aspects of knowledge transfer. They typically tend to be models of implementation and implementation science with some reference to knowledge transfer. But members of the audience will be familiar with models like Dan Schroeder's Consolidated Framework for Implementation Research. Paris is one of the highly known and widely used frameworks, and then others may be familiar with the Ottawa model of research use. And it's not to say that we don't need another model, but these models and approaches typically focus on implementation in principle, and KT is part of that. But what we found was that there was a lack of practical guidance for researchers as to how you can maximize the reach, the landing, and the impact of your research through effective knowledge transfer and exchange. So it was based in this context that I was lucky enough to collaborate with George Kernahan from Ulster University, funded by the All Ireland Institute, to develop an evidence-based model for KTE in palliative care. I've mentioned the Atlantic Philanthropies and HRB there as two of the major funders of the Institute and this research at the time. And we were also lucky to work with an excellent team of postdoctoral fellows and research assistants. You see Mary Jane, Kathy, Connell and Geraldine. So this is very much the learning that I'm going to share today is very much a group effort from these. But our focus was on knowledge transfer and exchange in palliative care. So we started off with an initial exploration of knowledge transfer and exchange in that context, because we wanted to explore some of the activities, barriers and facilitators in this area. And we were really lucky to be able to access a sample of very experienced researchers, principal investigators within the Institute's Palliative Care Research Network. We interviewed 9 individuals who between them had multiple projects that they were in a position to talk about. And our aim with that was to concentrate on their experience of dissemination, communication, both traditional and non-traditional in the context of those projects. And this paper, this research has been published as an open access paper in BMJ's Evidence-Based Medicine. And that was part of our commitment, was to having as much open access to our work as we could, and open access publishing was one way to do that. Access. So this paper is freely available to download, and you can review it in your own time. But just to say that in terms of a couple of key findings, all of the PIs and the projects that they discussed did clearly have some form of new knowledge to transfer, and transferring to a range of audiences. Only 4 of the projects discussed had a formal knowledge transfer and exchange plan in place. But what was interesting was all of the projects and all of the participants reported that they planned to pursue traditional knowledge exchange methods, so peer-reviewed publications, conference publications. But there was less discussion of what you might consider to be more non-traditional methods, using social media, using public media, using more informal engagement. And that was interesting because the target audiences for the knowledge that they had to disseminate was really, really broad. And as you can see, professionals, policymakers, service development, advocacy groups, voluntary organizations, all the way through the continuum of people. And one of the key things that we would have identified is that if you are interested in engaging with other researchers, other professionals, traditional dissemination routes may be effective. But if you're interested in going outside of those groups into more voluntary organizations, members of the public, stakeholders, they're not necessarily the methods that are going to reach those groups. So it was interesting that there was a bit of a disconnect here between the audiences they identified and the plans that they had in place. Now, I'm not going to go into detail on this slide, but just to highlight, we did ask the interviewees to identify the barriers and facilitators. And what was interesting but not surprising was that the presence of things like resourcing and time was a facilitator, and its absence was a barrier. So, for example, PIs talked about the situation that many of you will be familiar with in relation to research, that they were working on a funded project. There was a timeline for that project. The dissemination was planned for towards the end of that project, but by the end of that project, maybe your postdoc or your PhD student is moving on. Maybe you're beginning to work on your next grant, or you're beginning to implement your next grant. And the time that you have available for dissemination at that phase isn't necessarily as available as you would like it to be. Definitely capacity and skills were also present in the barriers and facilitators. So individuals who had developed good past experience around a range of types of dissemination spoke very positively about it, whereas for those who had less experience, they talked about maybe limited institutional capacity. One barrier which was interesting, which may speak to some of the researchers online today, is the recognition that in palliative care, that sometimes the negative perceptions of palliative care held by members of the public was a barrier to knowledge transfer, because there was concern around the acceptability of some of the messages from research, the emotional valence of some of those messages. And I imagine that for some of you working in the area of dementia, that there's concerns around the way in which the public's knowledge, attitudes and awareness towards dementia may influence their readiness for receiving information, or from adapting or accepting the messages. So a range of barriers and facilitators were evident in that paper. So we were conscious that even with really experienced researchers, we needed to think practically about how to support them. So our plan with EMTReK, our evidence-based model, was to take the best of the existing literature and identify the most relevant components for knowledge transfer. And it's important to stress that this work was based in health services research rather than specifically palliative care, because we wanted a model that would have some breadth of relevance to health services research. So study one, or phase one, was a systematic scoping review, which I'll say a little bit more about. Study two was a series of case studies to look at how researchers in palliative care found using the model. And the ultimate aim was to have a model that could be applied in palliative care and to make that available. So if anyone has any questions so far, please feel free to use chat and I'll address them. But if not, I will truck on. Okay, so just to say again, our commitment to being as open and transparent with our plans led us to publish the protocol for our systematic review. It was published in the Journal of Advanced Nursing. Unfortunately, it is the only paper that we were not able to make open access, and the others were, but we wanted to be very transparent in our plan for the systematic review. It was a scoping review of the literature. And again, just for those of you who've been involved in scoping reviews, and for those of you who are considering using them, to give you a little bit of a background, we conducted our systematic review, as I said, in health services research literature. And we identified, as you can see, initially 7,000 plus records across a range of databases. You can see the flow of numbers there, from the removal of duplicates, removal of non-relevant papers, particularly papers that didn't explicitly have information about the process of knowledge transfer or processes related to knowledge transfer. We had just under 300 full text articles that we assessed for relevance, and we ultimately ended up with 79 papers that provided some information. And we used thematic analysis to identify what we ultimately ended up calling the core components of knowledge transfer, and within those core components, the operational elements. So this was the resulting visual representation, and I feel very bold to be showing you this lovely sort of pretty version of the model, which actually came into being at the end of the project. We had various versions of it as we both developed our understanding of the model, and also as we, I suppose, developed our own skills in communicating the model. So this is our evidence-based model for the transfer and exchange of research knowledge. Now, I just want to take a minute and just say something about the name. One of the things that we share with researchers and colleagues around this experience of developing your knowledge transfer skills is that something as simple as a name can take a huge amount of work. I remember spending a day, myself and our postdoc, Lucia, thinking about the name of the model, thinking about the words that we wanted to have in there, thinking about an acronym that might be, have a good chance of being catchy or even rolling off the tongue. And we knew that we wanted to get evidence-based in there. We knew that we wanted to highlight that it was, again, transfer and exchange. And we also wanted to focus on research knowledge. At one point, it looked like it might be some version of T-Rex or EMTReK, which was very exciting for the dinosaur visuals. But we ultimately came up with EMTReK, our evidence-based model for the transfer and exchange of research knowledge. So this is EMTReK. So from the analysis of those 79 papers, we identified 6 core components of effective knowledge transfer. The first 3 are very interrelated, and they focus on the message that you want to transfer or communicate, the stakeholder that you're targeting with that message, and the process by which you intend to engage with that stakeholder, that audience. And these 3 can't be considered in separation from each other because they're so intertwined. And also they are not singular. Any research project will have multiple messages that are relevant to multiple stakeholders at different stages of the process. So we wanted to try and move away from this idea that there was a very simple linear process of message, stakeholder, process, done. That projects have multiple messages for multiple stakeholders and may require multiple processes to engage it. So they were those 3 core components. Now, the operational elements within those were really the areas where we felt the literature had given us some guidance as to how to address these issues. So messages that were needs-driven or actionable seemed to have a better chance of being communicated or disseminated, being received well, because they met a need and something could be done about them. Also, messages need to be accessible, but they also need to be credible. And it's one of the reasons why in introducing EMTReK, I gave you those numbers from our systematic review, because I wanted you to be assured that there was a rigorous methodology that underpinned this approach. And that feeds into the credibility of the model, we would hope. The stakeholders, I think all of the literature recognized that there are always multiple stakeholders. But what was interesting was that we teased out the knowledge producers, the knowledge users, and the knowledge beneficiaries. The users being actually the organizations, the practitioners, the professionals who may make decisions around services or programs or interventions. And the knowledge beneficiaries being the users of those services, the users of those initiatives, and their family members. So particularly in the area of palliative care, we would have users and carers very actively involved. And I know it's the same for dementia. In terms of the process, not surprisingly, you have to be very interactive in your approach to effective knowledge transfer. It can't be passive or one-directional. It does take skills. We looked at this idea of marketing knowledge about, again, not being passive, but actually almost selling, convincing the audience of the message. That it does take diverse activities, and one particular group of people who could be really effective are opinion leaders, people who are known in the area for having a commitment and knowledge or a role in relation to the particular topic, who can help you get the word out. But ultimately, that these processes have to be targeted and timely. You have to think very carefully about when and where you would implement them. So those 3 core components were very common in the literature, coming up equally in about 50 of the papers or thereabouts. The operational elements less so, because not everyone got into that detail, but we feel it's the operational elements that help implement the plan. The other 3 elements, the local context, the social, cultural and economic context, and evaluation, are also important. And local context was very much recognized as understanding that when you aim to disseminate research or communicate research knowledge, that there is an immediate context, the organization where the research was produced, the organizations to whom the research is relevant, there are influences, cultural and financial and readiness, related to readiness, that will influence the potential impact of that knowledge when it's transferred. And all of that happens in a social, cultural, and economic context. And that was very rarely discussed in the literature. And what's interesting is that, or what's interesting to me, is that we're living this reality at the moment. Discussions of research related to COVID-19, discussions of how messaging from public health and other organizations are being heard and received by the audience are so bound up in social, cultural, and economic factors at the moment, that how the messages land, how the messages arrive, is affected by that context, and it is something to consider. And ultimately, with the sixth component, we wanted to stress the need to be quite critical in assessing the effectiveness of your knowledge transfer. So I don't know if anybody has any questions or comments on the model as it is. I'll say a little bit more about how we used it, and then share some resources with you. Okay, no questions coming through on the chat function. Okay, so just to say, this is the paper that we published describing the components of the model. And again, this is an open access paper so that you can access it. And again, it's in the Journal of Advanced Nursing. We were delighted to go back to them, having had them publish the protocol for the review. And I just want to highlight a number of the steps that we are taking to support the use of this model. So first of all, we have a website, knowledgetransfer.ie. This is actually housed as part of the Institute's Palliative Care Hub for Professionals. The link is there, but we wanted to have a very shorthand accessible link that people could access. There you'll find a collection of presentations, linked to the papers, and also videos on EMTReK. And there's one in particular that was developed by our postdoc Kathy Payne, which really nicely captures a description of the model. We also have developed workshops with the Institute, and we're very pleased that they were recognised, or the work on that was recognised by NALA, the National Adult Literacy Authority, for plain language quality, because I think that's a key thing with effective knowledge transfer, is thinking about that accessibility of language. There is also on that page a process chart. This is a very busy slide, but we developed this, I suppose, to guide researchers to think about the model and the operational of it. So when you start to think about dissemination, and again, it should be at the beginning of a project, that you think about, number one, the purpose of your dissemination. What's your aim here? And depending on the aim, that will have implications. Then moving on to think, okay, so what are my key messages? What are the things that I want to get out there? Who are my audiences, and so on? And we've tried to give a sense of the complexity in each of those questions. So under methods of transmission, under how, number 4, you might think about different types of publications rather than simply peer-reviewed publications, e-zines, blogs, print media, policy briefs, things like that. And I think definitely number 4 really highlights how complex this is, and hopefully stimulates people to think of methods of dissemination that they haven't thought about before. But the big issue for number 5 is when do I do this? And traditionally, a lot of researchers will think about dissemination towards the end of a project, when they have their findings, for want of a better word. And we would argue that actually there's different messages that may need to be disseminated very early on. If you want to raise awareness about your project to hopefully bring gatekeepers on board, if you want to target potential participants and identify the relevance of the topic to them, you may need to be disseminating information about your research to raise that awareness, to build that connection from the very beginning. You also may find yourself in the middle of a project having an opportunity to potentially link with policy and practice in a way that wasn't planned at the beginning of the project, and you need to be able to be very responsive to engage with them. So this process chart was designed not to be used in isolation, but to be used with perhaps a more experienced peer or a supervisor or a team to brainstorm how you can make the most of the dissemination. Now, the last paper I'll talk about was our experience of actually finding out from researchers how they found using this model and whether it was beneficial to them. And this was focused on case studies in palliative care. And in fact, we were one of the case studies in an almost also ethnographic angle. We were interested in reflecting on our own experience, but we also had 4 other case studies of different types of projects that talked about their experience of using this model. And what we found in terms of that experience was that it was generally positive. The model was perceived to be credible. It was perceived to be accessible. And given its grounding in broader health services research, it was identified as being applicable to palliative care. In terms of people's experience of implementing the model and using it, a key theme that came out from the case studies was that awareness it's all about timing, that it's about the right messages at the right time, and that those times can't be missed. People spoke about the positive role of facilitation. We were able to, with members of the team, to work with each of the case study teams to support them to develop a dissemination plan, to deliver it. We were even able to provide a little bit of funding. And they found that facilitation really positive, but they also highlighted that the provision of resources for KTE was really important, because not all projects will have those resources. And then in terms of the outcomes, people felt that engaging with this model did enhance the quality of their research, made them more aware of the planning process and a more dynamic approach. But there were some limitations or areas for further consideration, particularly around resourcing and extending knowledge and developing skills in the group. But overall, a generally positive experience. And just to give you a sense, I've got 2 quotes here from 2 of our case studies who talked about their experience of using EMTReK particularly. So the first person talks about the fact that there are other models, but that this model was almost like bringing together the best parts of existing models. And what we do say is that when you look at EMTReK, there's nothing new within it. It's the bringing together of it, it's the operationalization of it, and it's the connections between those core components that we think is the sort of where the richness lies. So we were delighted with the experience of the case studies, and again, that paper is open access. So just to show 2 examples of projects that used EMTReK. So this is Kathy Payne. Kathy is up there in the top left-hand corner, and this April was her PhD thesis, which she did. And Kathy, who also later on joined our project, had an amazing insight into the multiplicity of dissemination and communication, from developing social media profiles, having those traditional academic outputs, but also having booklets and newsletter components and other visual and text-based resources that would engage. Louise, thanks for your comment. You mentioned that I suppose what I am trying to do is reinforce the importance of thinking about this from the outset and developing your skills. And that's definitely a challenge, because obviously some people are very familiar with more traditional methods of communication and dissemination, like the conference presentations and the peer-reviewed publications, whereas others may struggle a bit more with the less traditional formats. What's interesting though is, I say to my own students, I'm not the biggest fan of academic writing, because I find it hard work. I have to work at it. Whereas writing reports or writing for lay groups or writing for the general public, I enjoy much more, because it's more my natural style of writing. So I have to work at the academic writing, but I find the other forms of writing easier. And in any research team, you will have that mix of skills. You will have the person who's really good on social media and on Twitter and can take something really complex and detailed and simmer it down into the core components. So thanks for that comment, Louise. The other project I want to mention is a project called Kindle, which I was involved in, so possibly why I influenced them or encouraged them to try and use EMTReK. So this was a knowledge synthesis project, so knowledge, innovation, dissemination, learning and exchange. So this was an analysis of existing dissemination activities from 22 projects, which aimed to identify common messages in palliative care across those projects. Now, we in this project, we created a series of YouTube videos, animated videos that are only 2 minutes long for each of them, to communicate the key messages. So one of the key message was the importance of addressing the needs of service users while also recognizing the caregiver role. Another message was the challenge associated with palliative care research. So we were able to have, because we used a non-traditional approach from the beginning, we plan to have these 4 key videos. And you can actually check out the videos for the Kindle project on YouTube. If you search for Kindle project and AIIHPC, you'll find them. I've given you the link there, but it's not a very pleasant link to look at. So both of these projects focused on these non-traditional and traditional methods of dissemination. So for the Kindle project, again, we published our protocol for our methodology in advance, and we also published the paper afterwards. So I suppose some key conclusions to allow a little bit of time for questions. I'm conscious we were, with my computer hiccup, we were a little bit slow to start. But I suppose what I would say to you is that it is really important to think of knowledge transfer as a dynamic process of activity that runs across the lifetime of any project. And to be effective with this practice, you have to be able to identify the right messages for the right audiences at the right times. And the plural there is really important, because you will have messages, audiences, and different phases at which you need to disseminate. If you can approach this from the beginning of the project, developing a communication or dissemination plan, which allows you to identify those stakeholders, identify the potential messages, and identify how to engage with it, it can be really effective. And ultimately, using multiple media or multiple channels of communication to reach different stakeholders will maximize the likelihood that your research will land. We like to talk about knowledge landing. Knowledge implementation, knowledge use is a much higher bar. It's much more challenging. Just because someone knows about your research and wants to implement it doesn't mean that they can or will be able to. But at least if you know your knowledge is landing where it needs to land, it's more likely to have an effect. It's sort of like a research version of if you're not in, you can't win. So ultimately, my recommendation is to disseminate effectively, early, and often. And we hope that EMTReK, its structure and its process, can help researchers to really think broadly, creatively, and effectively about this. So that's my presentation. So I hope we have some questions or comments from people. I might stop sharing my screen. So Carol, I hope that came through okay.
So, yeah, absolutely. That was great, Suzanne. Thanks very much. I hope everyone else enjoyed that too. I found it very, very clear, very easy to understand. So that's great. Yeah.
There's a question from Francesca. Hi, Francesca. Francesca asks if I can talk a little bit about measuring the impact. This is really, really an excellent question. So one of the things that we found was rarely talked about in the literature was how do you measure the impact of what you're doing? Now, obviously, if you're developing or testing an intervention, you could say, well, the adaptation or the adoption of that intervention and its use in services is a measure of impact. That's such a high level of impact that it can be really hard to measure. Some forms of dissemination are easier to assess than others. With peer-reviewed publications, we have citation counts. You have the impact of the journal. With social media, you have likes, retweets, responses. There's a whole area of altmetrics within academic research now, which is looking at balancing the traditional metrics of citation counts with sort of alternative metrics of social media use. And you'll see a lot of the journals moving towards tracking that. So you can use some of those traditional metrics. But you can also be a little bit more creative. So let's say you develop a website for your project so that you can ensure good communication. You can use Google metrics to assess who's accessing that website, what areas of the website are they accessing, where are they spending their time. But you can also, as you say, Francesca, think about that sort of broader impact. So if your research is getting out there, will attitudes change. So if you're working with an organization around staff behavior or staff attitudes, can you do a sort of a pre and post, before and after dissemination, to see what the impact is? But also things as simple as feedback on workshops, feedback on other activities can be really useful. And I know Carol is planning on getting some feedback on the seminar series, and that would be one way of looking at it. Sorry, another simple one I'd mention is something as simple as reach. The number of attendees today is a measure of where my dissemination, my activity may have landed. So thanks for that. Carol mentions the HRB Open Research Platform as a good platform. Absolutely. And actually the open science movement, I think, is going to be one that raises the chances of us being effective with our dissemination. But still, I would keep in mind that who's the stakeholders, who's the audience that will reach, and is that part of your plan? Somebody asked me yesterday about whether social media, Twitter, is the sort of panacea for dissemination. And again, it is for those people who engage with social media and Twitter. It's not necessarily able to reach everyone. Carmel, you mentioned that you find academic writing very difficult. It is unfortunately one of the necessary evils of academic and research careers. The one thing I will say is stick at it. It does get easier the more you do it. But from a point of view of knowledge transfer, also don't be afraid to explore a sort of a publication portfolio for your work. So early experience of writing for maybe periodicals, professional magazines, blogs. Some of you may be familiar with the RTE Brainstorm platform, which is about sort of science and knowledge, can be really, really effective. Sinead asked with suggestions around best dissemination methods for people with dementia. One of the things that I think we don't necessarily embrace enough, and it actually relates to any research that targets the public, whether they require supports with communication or not, is plain language. Now, we're very lucky in Ireland. The National Adult Literacy Association provide a lot of resources to support people to embrace plain language. And sometimes I think that we as researchers struggle with plain language. There's a lot of jargon and technical terms in our communication, and moving past that can be a challenge, but also can be really effective. But ultimately, I think in terms of any plans to disseminate to the public, to stakeholders, to individuals who maybe need more support, is best done in collaboration with them. And obviously that links into PPI. So Sinead, I think obviously if your project has a PPI component, they can support your dissemination really, really effectively. When I was a very young researcher and doing my own PhD, I was writing to parents in primary schools. And I would always have my mum read the materials to see if she felt this was something that would catch her attention if it came home in the school bag. So definitely working with the people who you would like to engage with to get their support is really important. I don't know if there's any other questions. Neve asks about researchers using local media. Actually, I spoke about this yesterday, and I think local media can be a really underused source of dissemination, particularly for those earlier messages. So let's say you're developing a project working with a particular organization or in a particular locality, and you know you're going to be recruiting people from that locality. Going out engaging with local radio or local newspapers to talk about the project, to raise awareness, to give people a sense of why they should get involved and how they should get involved can be really, really effective. And because local media will often be very keen to have those locally relevant stories, they'll often show a willingness to work with you to develop something. So definitely local media can be really, really effective. The more mainstream media, it can be slightly challenging because you may be approaching them because you want to talk about a project that is in its early stages, but they may be focused on the messages and the findings, and you can have that sort of tension between the messages you want to get out there and the messages that they feel are most relevant. But definitely if you want to reach the public, you need to reach them via their own channels, and media can help with that.
Suzanne, there's some the 2 questions there under the Q&A, if you can
Oh
see
yes,
those.
I can. Oh yes. So Tope, really good point, Tope, about dissemination through publications is for promotion in the place of work. I think that's important to recognize, and it's important to recognize that it is still a very valuable form of dissemination because you're disseminating to your peers. And yes, it does represent your own career development and your own progression as a researcher. I do think that universities and other research organizations are becoming more aware of the importance of non-traditional methods. So in UCD, we have annual impact awards, which are about researchers having the opportunity to show how their research has had an impact beyond the traditional dissemination channels, where they've worked directly with organizations, where they've had that sort of recognition in social media. And also I know in UCD that we're measuring altmetrics now when we look at paper impact as well. So I think definitely there is an imbalance in academic settings where the traditional methods are seen as more valuable, but I think the balance is changing. Anya also makes the point about dissemination being active in the wider team. It is hard when you're the PhD student on a larger project and you have your own particular angle or corner, and there's probably a very clear plan within the larger project about dissemination plans, when the first papers will be coming out, who will be the authors, what will be the order of authorship on that. But that shouldn't stop you from other forms of dissemination. So for example, you know, professional magazines, organizational newsletters, things like that, as long as you're discussing them with the team to show how they create that portfolio of dissemination and ultimately contribute to knowledge transfer. I think you can actually become quite active with those other forms of dissemination. Zach asks about the importance of early stages and developing dissemination plans from the start. Zach, thanks for your question. I remember giving a presentation on the model at an early stage to my colleagues in the School of Psychology, and one colleague sort of expressed a concern that early dissemination of findings when analysis isn't complete or data collection is still ongoing may not be appropriate because obviously you don't have the full findings, and I absolutely take that on board. But what I would distinguish in terms of earlier stage dissemination is, first of all, that example of recruitment and engagement with organizations, getting people on board. You need to be able to share meaningful messages from your research, why you're doing it, what you need, why it's important at the very early stages to get those stakeholders on board with you. And they can be some of the very earliest phases of your dissemination that you want to plan. So that's something that you would be thinking about from the beginning, but you might not be thinking about it as knowledge transfer. But it is about getting the messages from your research out. But those messages are, why should I take part? What's involved and what does it mean? Also, many researchers have the experience that over the course of a project that the sort of early or interim findings may be necessary to sort of, again, continue to keep people on board, to give people a return for their investment, to give people an insight into how the project is going. So that may involve, say, workshops or journal clubs or seminars in the organizations in which you're doing research. Obviously, you want to be careful about not influencing the research, but you want to keep people on board, you want to have their support. But also you may think about a phased release if your study has phases to it, and that you can get those messages out there about appropriate early findings. I think it can help lay a very fertile soil for later dissemination of the sort of the main findings and things like that. So thinking about, again, different types of messaging at different stages, and at the beginning of the project, beginning a dissemination plan. The one thing I would say is you won't have the same dissemination plan at the end as you do at the beginning. It should evolve as other opportunities come into play, as other lessons or messages come up. So it should definitely be very much an evolving structure.